Hey, friends, quick heads up for all the mental health pros out there. Ever thought about making more money without adding more client hours? Well, if so, I've got something really cool for you. I've whipped up a list of 50 smart ideas to boost your income, all tailored for therapists and counselors just like us. Think online courses, digital tools, or even your own wellness product. And guess what? It is totally free. So if you want in, just click the link in the show notes. It's super easy to sign up, and you'll be browsing through those ideas in no time, thinking about all the possibilities. So don't miss out. Click the link in the show notes now, grab that list, and let's shake things up in your practice and your bank account. All right, here's this week's episode. Welcome to the Therapy Show podcast. I'm your host, Lisa Mustard. In each episode, I interview a seasoned and knowledgeable talk therapist from the counseling world to glean valuable insights, techniques, and tools that you can apply to your practice and your life. And if you're considering a career in the counseling field or just want to hear about what it's like to be a talk therapist, then this is the podcast for you. Today, we're diving into a topic that's both fascinating and incredibly important: holistic approaches to mental health. And my guest, Umu Benjamin, is a board-certified holistic, nutritional, metabolic, and integrative psychiatry nurse practitioner and the founder of Limbic, a company dedicated to transforming the way we approach mental wellness without immediately resorting to medication. And in this episode, Umu shares her unique perspective on treating mental health issues by focusing on natural and holistic methods. She discusses the importance of understanding how our bodies respond to stress and how lifestyle changes can significantly impact our mental health. And I agree with her 100%. So, with a background in helping over 1,500 clients, Umu brings a wealth of knowledge and experience to the table, emphasizing the power of nutrition, exercise, and mindfulness in managing mental health. We also dive into the topic of burnout, especially within the mental health field, and explore how her approach has helped a significant portion of her clients avoid medication by adopting alternative strategies for dealing with their symptoms. Umu's insights into the root causes of mental health issues, including the role of childhood experiences and the importance of setting boundaries, are both enlightening and empowering. Whether you're a professional in the therapy world, someone dealing with burnout, or just interested in holistic health, this episode is packed with valuable information and practical advice. So tune in and let's explore the holistic path to mental wellness together. Well, hey, friends, welcome back to another episode of the Therapy Show. I'm your host, Lisa Mustard, and this week's guest is Umu Benjamin. Welcome to the show, Umu. It is so great to have you.
Thank you for having me. I am truly appreciative to be able to be here with you today. Thank you.
Oh, yeah. Well, you're welcome. I'm really excited for our topic. Would you share with our listeners a little bit about who you are, what you do, and how you help?
Yes, thank you. So my name again is Umu. I am a holistic nutritional metabolic psychiatry nurse practitioner. I run a company called Limbic, and pretty much what Limbic does is takes care of mental health clients, but the goal is not medication initiation. The goal is how do we use natural holistic approaches, giving them options and giving them empowerment, lifestyle changes, and also looking at how their body responds to stress as a way to actually modularize wellness when it comes to mental health. So in my previous experience in general, we had over 1,500 clients, and 50% of them never ever needed medication. But that's because what we do was a little bit more unique to making sure we gave them the foundation that is needed. So even if they choose medication, they may never need to have a severe escalation in what is their management. So that's what Limbic does in general. We also run what is just information and podcasts and YouTube videos to kind of help educate our audience and our clients in terms of what they can be doing in their homes today to support what is their mental wellness. I hope that's a little bit more insight into what I do. Thank
Yeah.
you.
Oh gosh. Yeah. I mean, I've somehow I connected with you on Facebook. I went and followed you. I listened to your podcast, and everything you just said is definitely what I took from, checking out what it is that the content that you create. So I'm really excited to have you on the podcast today because I think we're going to talk about some things that I haven't quite touched on the show yet. So one of the things that we wanted to discuss was how to prevent burnout, especially within the field that we work in, the therapy world, mental health. And I also want to kind of touch on what you said about how 50% of your clients don't actually need to get medication once you explain to them some maybe holistic or alternative ways of dealing with their symptoms. So definitely want to talk about all the things. Where would you like to start when it comes to these topics?
We can talk about just what actually may lead to individuals seeking mental health, and that's
Okay.
burnout. In reality, it starts with burnout. If you look at what are the symptoms of burnout and you look at what's in the DSM-5 criteria, for any person, you can almost see how the symptoms mimic.
Mm-hmm.
Usually, burnout starts with you feeling dull, fatigue, low energy, low motivation, feeling helpless, hopeless, feeling aspect of changes in your sleep, rumination, anxiety. And when you actually stay in burnout as a phenomenon longer, you do tend to transition into development of depression. You do tend to have sometimes feelings of just feeling inadequate, regardless of all your accomplishment. So when we talk about individuals that may be into what is just entrepreneurship or solo entrepreneurship, aspect of their burnout is one that comes in insidiously. And many of us actually will go into this burnout cycles like a hobby. In other words, we get into where things gets a little difficult, things gets a little rough, and somehow we may shake ourselves out of it. But when we continue to prolong into it, then we actually start to get what are symptoms that may kind of present as mental health. So when I see clients like those, many times it's actually more beneficial to actually backtrack them to say, how do we put in different measures to prevent you from actually going where we now have to use medication, but we have not put in the lifestyle measures that may actually allow you to have a lifelong behavior adaptation to when your body goes into a burnout phenomenon.
Mm-hmm. Makes complete sense. Definitely. And I know that a lot of my listeners or our listeners experience burnout or overwhelm or stuckness, and they don't know how to pull themselves out of it. And I think we can only listen to so many other episodes of self-care for therapists before we're like, no, that's not it. It's not that I'm not taking care of myself. It's bigger than that. What would you say? I know you mentioned kind of like the different symptoms that people will present when it comes to burnout, but and you also said that if not treated, it can lead to, major depression. It can probably lead to other things as well. So, what are the things that you recommend when somebody comes to you and they're in those stages? I know you just said we kind of backtrack, but what are the things that you will tell them to do? The actual lifestyle changes that you're going to suggest?
I start by actually reminding them to hold grace or space for themselves, because aspect of us actually going into burnout as a phenomenon is not one that just happens because we are now running our own businesses. Aspect of burnout usually starts sometimes in childhood.
Mm-hmm.
A lot of individuals that are experiencing what would be burnout as an adult, including being in a business, yes, there's a demand that comes with running your business, but there's also a personality or trait that usually starts when we were younger. Most of us would have been caregivers. Most of us would have been people pleaser. Most of us would have been individuals that want to serve, but we did not develop the proper boundaries that actually allow us to navigate, regulate what is that energy exchange that may not serve us. So normally I get to tell individuals when burnout starts to happen, you actually have your brain and your body giving you signals. And usually the signals get to be, I should take a break. I am so tired. This is just not going right. Maybe I just need to kind of take a break from it for a while. I need a vacation. But you will have many of those internal signals that actually gets to be said to you by your body telling you, I need time away. And when we don't listen to it, it tends to escalate. So what I normally tell individuals is, many times when we start to think about burnout, a lot of us want to go to the bigger intervention. Let me take a vacation. That's wonderful. But if you're running a business, a lot of the times you are not able to have that privilege to truly pack your bag and travel and stay away for a week. It does happen and it would be wonderful if we can do so, but it starts with a tiny bit of interventions. So I get to say, learning to say no is self-care. That's part of you actually eliminating what is the burden of burnout due to the fact that we do not set proper boundaries. I get to joke around saying, if saying no is so difficult for you, take one day, definitely assess liabilities, but tell every person around you no. That includes our family, that includes the people we're working with, that includes even when we go into hiring individuals that do not serve what is our vision, mission, or any aspect of what we want within our businesses or within our lives. When we start to learn how to say no, we can also decrease what is that potential burden on our brains and our physical aspect of what burnout actually causes. Part of burnout does not just impact your psychological, your thoughts, feelings, and emotions, your non-verbal cues and non-verbal cues. Part of burnout actually is going to impact what is your physical and medical health, because your thoughts are action potential. They are going to induce chemical reactions within your brain and your body. And when we go into burnout, we are going to produce endocrine hormones that actually impacts our blood, impacts our chemistry. So when you're going through burnout, if you were somebody who were aligned with your body, you get to actually notice your blood pressure is going to be up, your heart rate is going to be up, your emotional eating is going to be up. You are almost struggling with what is just weight management.
Mhm.
And then your sleep and your energy. And a lot of people kind of just sweep these little symptoms under the table. But the more those little symptoms, physical symptoms, starts to actually be swept under the table, the more what is the burnout that happens in our bodies continue. Another intervention I get to say, start doing the smallest things that you may think are smaller, but actually makes the biggest impact. So we're talking about exercising is actually self-care. We have actually made self-care into this fantasy of going somewhere, going places, doing the luxury things. But in reality, is the smallest things that actually impacts decreasing the burden of burnout on your brain and your body. So exercise is self-care. Eating a healthy nutrition is self-care, because those actually contribute to decreasing what are the metabolic processes that happens due to the chemical changes that are happening at that cellular level. Prioritizing your sleep is self-care. When you do not sleep, any aspect of your burnout is going to transition to irritability, poor decision making, decision fatigue, anger, frustration, and any aspect of just you feeling yourself. And I get to kind of say some of the other interventions that are more holistic gets to be coming home at the end of the night, drinking a herbal tea that may be lavender, chamomile, anything like passion flower. Those are herbal teas that actually decreases your stress response, where you get to take time for yourself and actually be able to support that stress reduction. And if you are incorporating a lot of these every single day, and not all of them, it can be few of them, but just the fact you tapping into them allows you to keep chipping down what may be the potential effect burnout has on your body. I also get to say, taking the time to actually have your breath, or speak to your breath, or acknowledge your breath to slow down at the end of the day is another way to directly impact what is that cellular changes that do get to happen with burnout. And there's many more tips individuals can tap into when it comes to burnout, but the benefit gets to be you knowing, how does my body feel when I'm going into burnout? Self-assessment is the key. And for a lot of us, we are so heavily embedded in what we have to do, how we have to serve. And we may actually do it in the way that we take care of families. We put families to bed, we feed them, put them to bed. We stay up doing more work. We wake up when they wake up, and we do everything over again. But by us having to learn how to assess when we're going into burnout, we may prevent what may be the potential damage burnout has on our physical health as well as our mental health.
I want to share with you a fabulous offer from Therapy Notes. Have you ever felt swamped by endless paperwork and tangled schedules? Then step into a world of clarity with Therapy Notes. Hailed as the gold standard in electronic health records, Therapy Notes is your beacon in the dynamic realm of mental health care. With their round the clock 7-day live phone support, it's evident why they shine with a dazzling 4.9 out of 5 stars on trustpilot.com and Google. From effortless billing to streamlined scheduling, precise note taking, and state of the art telehealth, Therapy Notes is your all in one solution. And for the prescribers out there, they're ecstatic to introduce ePrescribe. And if you're switching lanes from another EHR, they've got your back. They will seamlessly migrate your demographic data at zero cost, ensuring you hit the ground running. So become part of the 100,000 plus mental health professionals community who've chosen Therapy Notes. And to embark on a 2-month complimentary journey, just tap the link in the show notes or use promo code Lisa at checkout at therapynotes.com. That's promo code Lisa, Lisa, at checkout at therapynotes.com. So dive into the Therapy Notes experience today and see why it's the talk of the town. Navigate with confidence and choose the best. Wow. Okay. So much, so many nuggets in what you just said. I'm like soaking it all in. I'm ticking off the checklist of, am I doing that? Am I doing that? Am I doing those things? Where do I fall in what you just shared? I mean, I couldn't agree with you more. Everything that you just said, I absolutely am on board with. So that's working with a client, when they come to you. So what's the next step? Like, how long do you, what would be next? You kind of check in with the client within a couple days, a couple weeks. Like, what do you do next, kind of for assessing where they are?
So normally any aspect of health, sometimes part of just the process of empowering the client gets to be you wanting to be available to handhold, to allow them to build confidence and autonomy. So when we see them for the first appointment, we send them what is just a little bit more detail of the tiny bit of things that they can start. And when I mean a little bit more detail, we focus on, are we going to work more on nutrition because nutrition may actually impact your brain health for this specific symptom? Are we going to work more on potentially inducing or helping you sleep because sleep may actually reduce the symptoms you're experiencing? So it's very highly individualized. And with that, we have a communication portal that allows them to communicate with us frequently. And there's an aspect of accountability. If part of your stress gets to be what is some of the lifestyle choices you're making, we want to see what are the lifestyle choices you're making. What are your entries or what are your journal entries of things you may be doing? And we go back with feedback and insight as to what are some of the things you can tweak, what are some of the things you can change, and what are some of the things that can be improved upon, as well as what are the things you are actually doing that are really wonderful that we get to celebrate you doing continuously to continue to foster what is just that positive output or positive outcome. So we are a little bit more hands-on. We are a little bit more hands deep because we're trying to make sure there's that interaction that allows them to, one, we keep validating what may be going on that's correct. We also validate what may be aspect of the lifestyle that's happening right now, how we get to help them change it. And we also get to support them with what may be new changes that can benefit them. But all of that gets to be us empowering them to start to learn more self-assessment, more self-alignment, and more self-regulation around the things that may be impacting their health and their well-being.
Okay. Okay. Yeah, it sounds amazing. And I'm already wondering, maybe I should sign up and get a session or two. Do you often recommend, I know you said it's totally individualized, but do you recommend supplements as well? Or are there other things that you recommend or you're assessing for?
Yes. So because of our holistic nature, the clients that do tend to find us are clients that are not always comfortable being on medication.
Mhm.
And medication is not for every person. At the same time, we also do know if somebody do need medication, there's an aspect of that for them. But part of what we do is to make sure we are giving them what are more things that are more natural and holistic in nature. And supplements and herbs falls into that category. We do have a lot of supplements that do have wonderful stress reducing properties and things that actually go into our bodies that help reduce what is that cellular burden that does tend to impact mental health. The same thing with herbals. There's a lot of herbals that we can use that decreases anxiety, improves your sleep, improves your energy, as well as just improve your overall sense of well-being. So we go into all of these for the clients that are comfortable using them. And the clients that are not comfortable using them, we get to offer them other options or choices that may still support what they're looking for in terms of options.
Okay. So you have many, many ways that you can approach this and help people depending on what their comfort level is. And
Correct.
okay. Okay. And so you practice in the Washington, D.C. area, is that right?
Correct.
Okay.
So we are seeing clients globally for any individuals that do want to have consultation.
Mhm.
And part of consultation gets to be you wanting to have a second opinion because many times lack of information can lead a person to make options or select options or choices that may not truly align with what they want. But
Mhm.
if that's what's been presented, you almost get to not know there are other ways to health management. And health is actually very holistic. So we see individuals that want consultation in the 50 plus states. But when it comes to license wise for clients that may choose medications, which we
Mhm.
don't have a lot of them, we are able to see clients in Maryland and Virginia.
Okay. I understand. So, pretty much anybody in the 50 states are able to work with you as and if they decide they do want medication, you can only work with those in the three states territories that you mentioned. Okay, makes sense. Okay. I think this is such a wonderful service that you're offering, and I know a lot of people would like a holistic approach. How did you come into the holistic side of mental health? How did you find it, or did it find you?
That's a wonderful question and very much insightful to what actually led me down this pathway. It's hard to determine what really truly found me. There's an aspect that I've always been tuned to. How do you optimize the brain and the body for wellness? But during my training, I spent time in inpatient and I'm seeing young pediatric clients that are on so many different medications and they've gone through what's considered medication trials. So we're talking somebody that's 10 and 12 who might have actually had about 5 to 10 different medication being introduced to them and they're still hanging on maybe 3 or 4 and each of the medication is treating similar symptoms but now they're in a lockdown unit.
Mm.
And one of the things I was able to start to notice over time was when we looked at some of the clients that were considered treatment resistant, things like vitamin D was deficient, things like their folate was not optimized, things like their magnesium was not optimized. But those patients, inpatient, were never getting those things assessed. They were just on medication. So when I started my treatment, as I continued to optimize those nutrients in my client, I noticed that what became considered treatment resistant was not happening to my clients. And the more I dug into research, the more I actually found out that all of those nutrients actually supports the brain cells down to the cellular level. We're talking how your neurons get to send communication, how you get to wake up in the morning having mental fog or not mental fog. And if you had mental fog and nobody's treating these nutrients, you may have an escalation in a specific medication to increase your attention. But the root cause is not that specific neurotransmitter. The root cause is the fact that your cells are lacking on bioavailable building blocks that needs to happen so you can actually be able to have your cells working for you so you're attentive. So as we did a lot of those and we saw improvement, that became our mode of treatment. That also meant we saw less of our clients needing an escalation in medication. And for us, seeing that and seeing that positive outcome and seeing how quicker we were able to resolve their symptoms was a given pathway to say this works better and conventional treatment is not efficient for these specific patients at all. So that became our finding pathway towards how we approach our wellness with our clients.
Okay, so what did you do? So after you were in that, you said rotation. I guess it was like a clinical rotation. Is that right?
Mm-hmm.
What did you do after that? Did you make a decision like moving forward, like I'm gonna focus holistically with my clients or?
I actually started working for a provider and actually trying to do what is more integrative approach. And it was frowned upon because it's one of those things back then they were like, it's not evidence-based and these patients don't want this, the supplements and what is those nutritional supplementation is expensive, they cannot afford it. So I felt there was a lot of aspect of constraint and bureaucratic pathways that were impacting truly what I wanted to do. So I actually opened my own practice.
Mm.
And to me, that was what allowed me to feel more fulfilled, serve the clients I wanted to serve, and be able to make recommendations that supported their health. And as we were actually going through the process of seeing them getting better, and a lot of them were actually buying and taking the supplement, it kind of solidified what is just that pathway of understanding that the narrative was they don't want it. Most of them don't want to get well. The supplements are not going to work. They cannot afford the supplement. It became one where we actually understood that if you do not educate clients about the choices and options that can optimize their wellness, they're not going to have what is that informed consent or decision-making capacity to select choices and options that truly elevates their wellness. So that became what we felt was more in alignment with what we wanted to do or what I wanted to do as a practitioner or a clinician.
Okay. Wow. Wow. What a story. Like was there pushback? Like, did you ever feel like, is this gonna work? Can I make this happen? Like,
I did not feel like there was, I didn't have any question about whether it was going to work or not working, because one of
mm,
the things I've always done was things that I try to recommend for my clients are things that I actually also try to practice at home.
mhm,
So I practice eating healthy, I practice exercising, I take supplements, I love my supplements. And when I have gone through aspect of burnout, and I am notorious for severely going through the cycle of burnout,
mm,
so I actually got older. I've learned how to start seeing burnout coming a mile away and putting in what would be blocks to support my health.
mhm,
But part of that was me actually taking supplements. And I actually noticed by choosing nutritional supplementation and putting in a lot of the lifestyle options and choices, my brain was working healthy. And when I observed it in my client also, that was aspect of saying, hey, it's worked for people who I've recommended to outside
mm,
of clinical practice. Research supports it's actually helping the brain cells. My clients, or the few clients I'm putting them on, within few weeks, they're actually feeling an improvement in their symptoms. I was just going ahead with it. There
yeah,
wasn't an aspect. One of the difficulties was having to encourage clients to stay longer or consistent, because many times we want wellness to come quicker, but usually it's taking months to years, decades for a lot of us to actually get to the point where now burnout as the symptoms have turned into things like mental health. So it tends to need a little bit more time in patient, or we tend to want to have a little bit more time in patient to see our symptoms improving. And many times it just means consistency, 3 months to 6 months of being on a specific regimen and a specific lifestyle options to actually see that the natural approach also works.
mhm. Okay. This is just so amazing. And it's like, I know these things. I know that, when you eat better, when you take your supplements, get your sleep, when I know these things, right? Like I know how to do them and I hope I implement them well enough. But so many people just, they know it, but they don't put it into action. I really find that to be interesting. And you said something that reminded me of something that I've been saying a lot is a change of thought gives you a change of action. So is that something that you work on with your clients, like the thought patterns and, how they think about things and
So self-care is also a mindset change, right?
Mhm,
The clients I've worked with, any aspect of what is that learned behavior with adaptability or lack of tolerance to stress started a long time.
mhm,
So when we see, like you said, a lot of individuals know these aspect of interventions that can be done, but sometimes it's difficult to navigate into it. But that's because our brain as an organ is a very highly intelligent organ per se. When it's learned some specific behaviors, regardless of whether they're not good for us, under stress, it's very easy for that pathway to want to reopen,
right,
allowing us to pick up those old habits again. And part of just having to modularize yourself into a direction that serves you better is mindset. Mindset is self-love or self-care, because if you are aware that under stress, your brain may want to bring those old pathways and old behavior back to surface, it allows you to be a little bit more mindful as to when stress starts to happen. I need to start putting some of this intervention in place or double down on this intervention to prevent me from actually going down the pathway where now I'm experiencing burnout. I'm in the depths of burnout. I'm actually experiencing what is just changes, physical and medical change and mental change due to the effect of burnout on my brain. So those would be some of the things I encourage my client. Part of wellness is to allow all of us to understand we are human, which means we can get things corrected consistently, maybe few days out of the week, few months out of the weeks. But however, when you have a relapse, not to feel so judgmental or self-defeating over those relapse. Pick up yourself and start the next day with a new mindset or any aspect of the interventions that have supported you and continue moving forward. Because if you pay attention too much to, oh man, I just went back down that pathway and that's causing my symptoms again, that actually have the brain goes down that negative pathway that activate the hormones within your brain and your body that impacts what is just your mental progression, which turns around and impacts your physical progression. So we get to say, yes, a lot of us may have this intervention as two kids. And yes, a lot of us sometimes may not tap into it, but many times we are actually able to tap into it is when we become burdened with aspect of stress, leading to burnout, that sometimes we are unable to truly tap into it. But using mindfulness as a way to start putting in a daily routine that takes all of these interventions or different aspects of this intervention, prevent you from actually relapsing versus actually enables you to have what are those adaptability skills that moves you forward.
Wonderful. Okay. Okay. I love how you present this. It makes so much sense to me. I hope that people listening will check out your podcast for sure, because you give a ton of, oh my gosh, so much psychoeducation and so much value. How often do you record your episodes?
I record them once a week, and we
Mhm.
normally have them come out on Thursdays. So yeah, that's been for a year now. So I'm hopeful I have the energy to continue to do so.
I hope so. It's wonderful. Your podcast is so good. So much. I mean, I learned so much. What was the one I was just listening to? It was about menopause, I think. Was there something about menopause?
I do one on PMDD,
That's what
which
it
is
was. Mhm.
which is just an aspect of symptoms that comes in around the menstrual cycles that have individuals having what are changes in their energy or their anxiety or their mood, and trying to educate women and empower women that when these symptoms comes in, instead of us having to panic, a perspective view and intervention view may actually support you being able to actually navigate what are some of these symptoms that happens
Mhm.
naturally, and not to stigmatize what is some of just aspect of what media makes it seems like in terms of having the labels and the diagnosis. So that's part of what my mission is with the podcast. How do we still get to talk about mental health, but remove or help with destigmatization of it, as well as putting in simple approaches that we can take every day to improve what is our physical and mental health. So
Yeah. Yeah, awesome. Well, I will put the links to your podcast in the show notes as well as your website. And if anybody wants to connect with you and learn more, I do want to ask a couple questions. So as we're kind of course, wrapping up, I have another question. Do you work with children though? Do you consult for with parents on their children?
yes, I
Okay.
see pediatrics as young as 12, and obviously we see all the way up to adults.
Okay. And I was just wondering, the rise of the diagnosis of things like ADD and ADHD, is that something that you are able to consult with parents about?
Correct.
Mm.
There's an aspect that the reason we choose to work with pediatric patients is because if we are able to start to help them become more insightful and mindful as to the symptoms that are happening, how they can start becoming more empowered to take in some of the lifestyle choices and options, they can actually get a little better. We do work with what is ADHD, and part of what we try to do is help them learn what are some of the things that they can do to optimize how the brain becomes more illuminated, how the brain becomes more focused. How do we put behavior modification in? Because you can drop a child on any medication, but if you did not go back and feed the bio blocks or building blocks of the brain, and you do not put in the behavior modification, those meds eventually plateau, do not become effective, but then we have not actually put in the lifestyle options that supports them through adulthood. So these are the kids we actually see when they do go to college. They may still be on medication, but they're actually experiencing significant deterioration in what is just their academic performance, their social performance. And that's because some of the things that needed to happen to allow them to learn a lot more better about how their brain works were not put in place. So that's something we do a lot of.
Okay. What other mental health conditions would you say you help families with their children?
So we actually help individuals understand how anxiety is created in the brain and the body and how it gets to be expressed, which depression, insomnia, mental fog, ADHD when it comes to you using holistic approaches towards treating your ADHD and managing it. And aspect of mood that is around what is just feminine health. And I do talk on other topics on my podcast because I am board certified, which means I'm training all of those aspects, but I am not per se seeing clients. And those, one of the things I talked about is just maternal health and the impact some of our lifestyle or changes in our nutrition or changes in what are the cumulative burden that we accumulate as females before we go into childbearing age, and that impacts females who may actually struggle with mental health post-delivery of their child or postpartum depression. I do talk on that, but I'm not that's not my forte. That's not my expertise. There's a lot of people that do a wonderful job of maternal health, but I'm going to talk on my podcast. I'm going to talk about general mental health and wellness, but my focus is anxiety, depression, PMDD, mood, insomnia, mental fog, and any aspect of performance. How do you get to have your brain perform for you in the way you need to? Because our brains are actually highly able to be coached and supported into optimizing itself beyond what a lot of us can imagine. And that's one thing I'm good at.
Yeah. Okay. Well, thank you so much. I mean, I love this episode. I'm so excited for our listeners to hear it. Is there anything else that you want to share or to let them know?
So far, I think we've covered a lot and it's wonderful. I would encourage them to feel free to come to my podcast and feel free to almost send in questions or concerns or any aspect of feedback or things they may want to hear. Again, I truly appreciate you having me come on your podcast to be able to showcase what is any aspect of what I do.
Oh, I've so enjoyed it. Thank you so much for being here. This has been great.
Thank you. You have a wonderful day.
Please note that the therapy show with Lisa Mustard is for informational and entertainment purposes only and not a substitute for professional medical or mental health advice. Always consult with your therapist, doctor, or physician before implementing any suggestions from the show. The Therapy Show with Lisa Mustard is edited and engineered by Chelsea Weaver. If you're looking to start a podcast or ready to take the editing off of your plate, be sure to visit chelseaweaverpodcasting.com. Well, that wraps up another episode of The Therapy Show with Lisa Mustard. I know there are hundreds of thousands of podcasts out there, and I'm thankful you've chosen to listen to mine.
Be sure to visit lisamustard.com to access the show notes and discover more fantastic content.
And I'd be grateful if you subscribe to the show. Thank you.